Podiatry is a branch of medicine devoted to the study, diagnosis, and medical and surgical treatment of disorders of the foot, ankle, and lower extremity. When you experience foot pain, your life could be very hard. Board-certified podiatrist Dr. Michal Waldman at North Tampa Foot Care tells us about treatments for conditions of the foot.
Your feet are the foundation of your body, so when you have problems with your feet, it can really affect your well-being, and this can make it really difficult to manage all aspects of your life in a healthy and productive way. We have the latest technological innovation in direct transmission x-rays, which produces an image within 10 seconds that the patient can view inside the treatment room. This allows the patient to get a much better understanding of their condition. We treat any and all aspects of foot and ankle medicine and care, but really stress the non-surgical, non-invasive treatment like stem cell injections, which can promote healing, repair both chronic and acute injuries like fractures and or sprains, and also are used to treat arthritis, tendonitis, plantar fasciitis, and neuropathy. Stem cell therapy is one of the several amazing medical technologies that uses the healing power of the body to repair injuries, promote healing, and reduce pain. These regenerative treatments are among the most significant advances in modern medicine. Stem cells and amniotic fluid are injected into the injured area of the foot and ankle where they replicate and flourish. The magic happens when the surrounding cells mimic the stem cells, creating an anti-inflammatory effect that reduces pain, heals both chronic and acute injuries, and promotes healing. Furthermore, the stem cells and the amniotic fluid contain hyaluronic acid, and when we inject these into the joints, they lubricate the joints and tendons, often seen in osteoarthritis, that can promote healing, reduce pain, and replenish and restore mobility. Most patients agree that the entire process is virtually pain-free. This is a case of a 74-year-old healthy male who came into my office with chronic ankle pain that he had had for about 7 years. He had never seen a doctor before, and so when he came in, we took x-rays, and as we could see, he had an undiagnosed fracture right over here in the back of his ankle, which was causing him a lot of pain because it had never actually healed. We talked about things like physical therapy. We did make him some prescription insoles, which helped a lot, but he still had pain whenever he walked or drove his car. So we gave him some mesenchymal stem cell injections with amniotic fluid right into the fracture site right here in the office. And 2 months later, you can see his post-injection x-ray. The fracture is completely healed. He also had no arthritis after this, no more pain, and he's been able to walk around 7 miles a day now without any issues. In this case, a 75-year-old diabetic patient came to my office after she had fallen and sustained a really terrible midfoot fracture called a Lisfranc fracture. She did have to get surgery in order to put her bones back together appropriately, and that led to really terrible post-traumatic painful arthritis. So subsequently, we had to remove the hardware, and after doing that, she still had some pain left, as you can see from the arthritis in her midfoot right over here. So after doing physical therapy and giving her special types of shoe gear, she was still having some pain. She was a great candidate for these mesenchymal stem cells and amniotic fluid. So we went ahead and injected her twice. And after about 3 months, you could see along the top of her foot where she originally had the arthritis is almost all gone. She has no more pain. She actually recently ran her first 5K. This patient was a 60-year-old patient with several immunocompromised conditions. He came into my office when he twisted his ankle and had some foot pain that wasn't going away. On his initial x-rays, you can see he had a fracture of his 5th metatarsal base, which was very painful. And because of his age, as well as the fact that he had several immunocompromising conditions, we knew that we were in for a challenge to try to heal this conservatively. We did go ahead and attempt to heal it conservatively because that was what the patient wanted, but after about 90 days, we saw that it just wasn't healing well or fast enough. So I went ahead and gave him stem cell injection, and 2 weeks later, this is his post-injection x-ray with the fracture completely healed and absolutely no arthritis. Needless to say, he was very happy with the results.
I came to see Dr. Waldman after having some residual pain after a previous Achilles surgery I had. Being a former athlete, I really wanted to get my level of activity back up to where it once was, so she suggested getting stem cell injections. After doing so, I saw the swelling in my Achilles go down pretty significantly, and my activity was up to where I wanted to be.
The North Tampa Foot Care staff is here to help you build a strong and healthy foundation by addressing any podiatric issues that may be keeping you from your best self.